Hi everyone, Dr. Kerry Yerke here, and thank you for joining me today for this webinar on foot pain. We do see people in the clinic for foot pain. I've seen many different foot conditions over my career. Today we want to talk about the different foot conditions we see in the clinic and how we can help people. So today's topic is foot pain. It's part of our webinar series that we have on Wednesdays here in the clinic. And please join us for future webinars. You can see the events listed on our Facebook page under events. My name is Dr. Kerry Yerke. I've been practicing for over 25 years now, and I've seen thousands of patients in the clinic for a variety of different conditions, spinal conditions, other joint conditions. And I've done over 100,000 adjustments in my career on the spine, the hips, the shoulders, the other joints in the body like the knee and the elbow, hands and feet, TMJ. So sometimes people don't think chiropractic can help with certain conditions, or it's not top of mind, but chiropractic works on the joints in the body, works on the muscular system, and the chiropractic care affects the nervous system as well. So we're going to talk a bit about that today and how we can help people with foot pain. I'm located at the Landmark 4 building in Kelowna, and that's the 3 glass towers. And we're currently accepting new patients in the clinic, so you can click on the link in our post and you can easily book an appointment online, or you can call the number we'll leave for you in the link as well. You can message us on Facebook or social media. We're fairly quick to respond to those channels. So today's webinar is on foot pain, and we want to talk about where foot pain comes from and what causes foot pain and what we can do to help. The foot is composed of a number of different joints and bones. So there's many bones in the foot, and foot pain can come from a number of different sources. For example, we see people spraining their ankle. We'll talk about that today, affecting the main joint right here called the mortise joint in the ankle. We see people that turn their foot over, roll their ankle, and sometimes that affects this bone right here, the cuboid bone. And then we see people with poor posture and alignment of their body and the foot. That can cause fallen arches running through the middle part of the foot here on the underside of the foot, as well as it can cause the toe to deviate and a condition called bunions. The first condition we're going to talk about is sprains, and sprains come from rolling your ankle, and it's very common for someone to step on an uneven surface and twist their ankle. Or maybe you're playing a sport like basketball, and when you go to land, you jump up, you land incorrectly, or on someone else's foot, and you roll your ankle. That can really twist the ankle, and it can damage the tissues in between the bones, stretching the ligaments, sometimes partially tearing the ligaments and causing the joints to become unstable and the alignment of the ankle to become poor. Sometimes we see repetitive types of sprain injuries where people are walking a certain way and have their feet are crooked, and that can cause repetitive sprain type of injuries. For strains, we refer to strains as the musculature and the tendon, so straining the muscles and the tendon running through the ankle and the foot area. There's a number of long muscles going in the shin area and the back and the calf, and these tendons run through into the foot region. There's some shorter muscles and smaller tendons right here in the foot as well. And these tendons can get strained and the muscles can get strained, and that can cause pain in certain areas, like on the outer part of the shin area called the perineal area. The perineal muscles, and on other areas of like the back, the calf can get strained. You can have shin splints up here due to improper alignment and poor function of the foot and the mechanism when you're doing athletic activities. So these are conditions we see from sports and from walking and doing physical activities. Posture has a bearing on your ankle and your foot. And So posture, if your posture is improper, like this picture on the left, it can cause more weight on one side than the other, and that can overwork the joints on one side. And it could lead to premature degeneration or arthritis developing on one side faster than the other. And we see this in the hips and the knees, but we can also see this in the feet as well. And our goal as a chiropractor, of course, is to get balance and symmetry back and realign the body so it has good posture. Bunions, that's something we see from a lot of times from improper footwear. If you're wearing shoes that have higher heels, if you have poor alignment to the feet, it can cause forces to change the ligaments and the tissues, and then the tissues adapt to the force being put on it, and eventually we can get alignment changes in the feet. And this can cause inflammation, it can cause the joint to get hot, and it can get the joint can be very sore with a condition like bunion formation. Arthritis affects the joint spaces. It narrows the joint spaces, causes wear and tear in the foot area, causes inflammation, and then we see these common types, osteoarthritis being the most common type we see in the clinic, but we see rheumatoid arthritis as well, which is more of a systemic arthritis, and sometimes we'll see conditions where people present with a sore foot or a sore toe, and it's something like gout, where we have to refer the patient out for medication. Footwear is very important. The arches of the feet and the support of the footwear. Sometimes people, when they wear high heels, it changes the angle of the foot and it can cause the ball of the foot to become very sore, or even eventually lead to the toes getting squished and the toes overlapping. We've seen those kind of conditions. So we really want to address the pain when it first starts and find out what the cause is, and then hopefully correct it and provide advice as far as footwear and proper supports. And it really comes down to physics and the forces being put on the joints and the joints adapting to those forces. For footwear, we like to recommend shoes that have good soles and cushion, as well as a good flexibility in the sole to match the flexibility of the foot, and then some good support in the ankle, good lacing so that we can make sure the foot is supported all around. I have a picture here of Skechers, and I really like Skechers, both for myself and for my patients. And I find that they kind of check a lot of the boxes, but there's other shoes out there that are very good as well. We do orthotics in the clinic, and when we do an assessment of someone, if we believe orthotics will help them, we'll do an impression of their foot in a foam cast like this. Based on our assessment, we'll have a diagnosis and we'll write a prescription that goes in with the cast. We'll send it away to our orthotic supplier. They will make an orthotic, either a 3/4 length one or a full length, or sometimes even a shoe with an orthotic in it to help support the changes we're making in the clinic. Sometimes people will need a heel lift if they have a short leg, or there's been some injury. Maybe there's a fracture and there's a short leg because of that. They've had a surgery and they've got a short leg. So there's a number of different reasons why people may need a heel lift and may need to get orthotics or proper footwear. There's many nerves that run through the foot. So these nerves are coming down from the sciatic chain and then branching out behind the knee, and then two main nerves travel down into the foot, and then they branch out in the foot region. And the nerves can get pinched or irritated, and that can cause things like neuromas to develop, which is a painful condition where the nerves are getting pressed on. Sometimes it's this transverse arch right here in the ball of the foot that gets affected. Other times it's this long arch right here, the plantar arch that most people know about, where we could see a fallen arch, a condition called plantar fascitis. And sometimes that can even lead to the tendon being pulled away from the bone right here. The bone tries to adapt by growing more bone, and we start to see a heel spur develop in this area. So nerve conditions can lead to things like neuroma, pain, even numbness and tingling or weakness. Other joints we like to assess in conjunction with the feet is the overall posture of the body, the alignment, the hips, the knees, and the ankles. So we like to look at everything and make sure that we're getting the big picture of why the person is coming in with the condition that they have. So what can we do about it? Well, we'll do a history so we understand the condition well. We'll do an examination, which includes the joints we just talked about. And then we'll take x-rays if necessary to see if there's any underlying pathology, what the condition of the bones and the joints are in, and what kind of alignment we're dealing with in the foot. We use digital x-rays in the clinic. The digital x-rays are great because they're instantaneous and they're of high quality. So the x-rays allow us to visualize the bones, the joint surfaces, the soft tissues. They're of great quality, great value to us to be able to help in our diagnosis and assessment of different conditions. For treatments, we do adjustments to the feet where warranted, and so we'll do adjustments with traction type of adjustments, specific adjustments to the bones in the feet by hand or using an instrument. We'll advise on supportive devices like wraps that go around the ankle to support the ankle if it's been injured. We'll give exercises, and we'll advise on lifestyle so that the person can get back to the way their body should be. Some of the stretches we like to give in the clinic are specific stretches like yoga type of stretches or exercises to do where people will stretch and strengthen the joints in the feet. For posture, we advise on the proper alignment for posture, that it may include the proper shoe wear, and what we want to do is make sure the force on the body is equally distributed right to left and front to back. If you're interested in booking an appointment with us, we will leave a link in the post for you. Right now we're offering $15 off the first visit if you book online. So you can click on the link and book an appointment, and you'll get $15 off the first visit. Usually we could see new patients within 48 hours. So when you do book an appointment, most of the time we can see the person the next day or the day after. And this offer is good for the next 2 weeks. You can join us for upcoming webinars, and the upcoming webinars are on conditions like back pain. I did write a book in 2019 on back pain that's on Amazon, so you can just type in back pain and my name, Dr. Kerry Yerke, you'll find that book. As well as neck pain. I wrote a book on neck pain. You can find that on Amazon as well, and we do have webinars on neck pain coming up in the near future. We do other webinars on conditions like joint pain, and sometimes we'll get into specific conditions, which will include things like headaches or sciatica. Today we did foot pain. We do plan on doing a webinar on hand pain coming up. So please follow us. You can follow us at Dr. Kerry Yerke on our social media channels. That is Facebook, Instagram, and Twitter. We do have a podcast called SuperHealthy. You should be able to find that on your favorite podcast provider, and that could include Apple, Spotify, and Google. We are on YouTube at Dr. Kerry Yerke on YouTube, so please subscribe to our channel and you will see recordings like this on our YouTube channel. Our website is kerryyerke.com. And again, if you want to book an appointment, we're offering you $15 off the first appointment if you book online. You just have to click on the link in our post, and most new people can get in within 48 hours into our clinic. We do have later hours during the week, as well as weekends and holidays, so the clinic is open most days. And this offer is good for the next 2 weeks, so please click on that link, and then that'll take you to the booking page where you can easily book an appointment. So I want to thank you for joining us today. I hope you learned something about foot pain, and we'll see you next time.